Good morning, everyone.
Good morning.
I welcome you all on the second day of your series. I hope you all are enjoying.
Yes. Good.
Myself, Dr. Ritika Sharma from PG Scholar, first year, Department of Panchkarma. I am here to present another topic to all of you, that is Udvartana, powder massage. I will try to clear most of the queries after the session and during hands-on training period. If in case anything doubt after the session, you can ask me, okay?
Sure.
Let's start.
Yes. And before we start, how can we get these PDF? Like, we are not.
We will make you available these PDFs as will be
Like the same thing.
Dr.
and
Dr. Mehak,
they will
provide you.
Like, we have to go and reach out to her, like, by
We
itself.
will say to them, they will get it. Introduction. The procedure of massaging the whole body below the neck with the medicated powder in a direction opposite to the orientation of hair follicles with some pressure is called Udvartana. In Sanskrit, the word Udvartana means to move something in an upward direction. So what does it actually mean? In this, we use the medicated herbs in a powder form, and below the neck region, we against the orientation of the hair follicles. If you can see your hair follicles, they are directed downward direction. So against the direction of the hair follicles, we are applying the pressure opposite to them in a unidirectional form, in upward direction towards the heart. In Sanskrit also, the word itself means that to move something in an upward direction. This is the introduction. Next, what does it actually mean? It is a process of applying powders of herbs to the skin below the neck and rubbing it in gentle strokes, deep as well as superficial, directing towards the heart with the palm evenly spread on the surface of the skin. What we do actually, as I told is, ma'am, we use medicated herbs powder. We use them below the neck region, rubbing it in a gentle strokes. Deep as well as superficial, here mention about the pressure. The pressure which we provide to the patient's body. Deep that means that the pressure will be in a vigorous, in a more manner, and the superficial will be a mild pressure will be given to the patient's body. It is directed towards the heart with the palm. We will be giving the pressure with the palm of our hand. It will not be from the wrist joint or shoulders or our elbow joint. It will be given from the palm of the hand over the patient's body, evenly spread it over the patient's body. Okay? It provides a frictional movement which is applied in Pratiloma Gati opposite to direction of hair follicles. As you know, when on a subtle surface or in a constant surface, we need a friction or resistance to move in against that surface. So for that surface, a frictional movement is created in a subtle body against the pressure that creates a frictional movement. That is now which is applied in a pratilom gati. Prati means opposite, lom means hair follicles. So opposite to direction of hair follicles. Udvartana is mentioned in daily regimen, that is, it can be done daily in the early morning before taking bath. In Ayurveda, it is mentioned as a dinacharya part. Like it can be done daily. You should have, I think, mostly females. They do upturn and scrubbing in the, okay. So this is one of that kind. We can do it in a proper daily manner, but before taking the bath in the early morning itself. But here, I will be telling you it's a therapeutic proper procedure which I will be telling you what we have to do before procedure and after and during. In the picture also, you can see the patient is lying in a prone position, and powder is instilled over the body of the patient. Okay. I'll let you know about the techniques, what our techniques we'll be using for the same. Indications, in which all cases we indicate this, as it is can be done for a dinacharya as in a daily regimen, so healthy individual is definitely indicated for this. Obesity, obese patients are first and foremost indicated for this procedure. It helps to emulsify and liquefy the fat globules which are present in the obese patients. Okay. High cholesterol, there is very lifestyle disorders causing usually obesity that results in the cholesterol levels increment and triglycerides also. So it is helpful in that types of diseases too.
That's the friction which just allows to liquefy the fat.
Yeah. PCOS induced obesity. Nowadays, polycystic ovarian syndrome is very much common in women. So it helps, if it is induced due to obesity, it definitely helps in that situation too. Excessive sweating. Some patients who are obese, not only obese, thin also, are having some kind of excessive sweating in the body. So that helps in the removal of that too. Okay. Contraindications, in which all conditions we will not go for Udvartana. First of all, the open wounds and burns. You yourself think of that if you are having kind of burn and open wounds, it can exaggerate the condition if you are applying any kind of herb or medicated powder to the part. So it may cause infection in a severe form. Okay. Dry skin conditions. Udvartana itself is a dry form. So if you will apply over a dry skin condition, it may exaggerate the skin more vigorously. Active bacterial and fungal infection. Most of the panchkarma procedure, in fact all the panchkarma procedures, we don't do any kind of procedure during if the infection is due to bacteria or fungus. In pregnancy also we don't hamper the normal growth of the fetus, so we don't go for any panchkarma procedure in that area, so it is contraindicated in this also. Infants, yesterday also docs have taught you about the abhyang, that in young infants and newborns we perform the abhyang procedure, but as the infant skin is very sensitive, so we don't do Udvartana in infants. To the emaciated, for this, as I told, the indication is obesity, so emaciated is not so capable of getting this procedure to handle this procedure, okay, so it is not indicated for them. Hypersensitivity and allergy. In case patient is hypersensitive or allergic to the powder, if in previous or past history he's told you that he is allergic to some kind of powders or herbs, so it is definitely hypersensitive, so don't go in that procedure. After body detoxification and purification procedure of panchkarma. Today also doctors have taught you one of the panchkarma procedure, it is Nasya, and next 4 will be taught to you in the next subsequent days. So after performing all the panchkarma, 5 main panchkarma procedures, we will not be doing any kind of Udvartana or any kind of other procedures too, but it is contraindicated in those procedures. In digestion, definitely if the patient's metabolism is not so good and the digestion process is not so up to the mark, then we will not be performing any kind of procedure, including this too.
And second last, I couldn't get it.
After body detoxification and purification.
Isn't it like all the processes are following the same thing, body detoxification
Like
and
mostly 5 panchkarma procedures told by you, induced in message, woman, vibration, everything else. After performing, if we have done that to the patient, if patient has gone through those kind of procedure, we will not be going for any of the local procedure after that. Like we will not be performing Udvartana after that.
So in those we are not, this abhingam we are not counting in those 5.
No, it's a pre-procedure type.
Okay.
Before any of those procedures, we perform pre-abhyang and then only we go for them procedures. For every 5 of the procedure, we have to go for abhyang.
Okay.
What all things we require? First of all, the droni. You can see. Yesterday also we saw. Okay, we need a patient to make perform the procedure, so we need it. Bowls 250 ml capacity, minimum of 250 ml capacity. Why we need them? To keep the herbal powder where we will keep them, so we need them. Spoons to stir the powder, pans to heat them. Hot water facility. After the procedure, when the procedure is done, patient is asked to take lukewarm water bath. So for that we need a hot water facility. Soft towel to wipe off the powder. Gloves are optional in case if the measure himself or herself and the patient is suffering from any kind of contagious disease, then we need to wear the gloves at that condition. Apron, as the powder it easily spills off, so we need to wear the apron. For this, definitely we need to wear it. Manpower, it's 2 therapists. Why we need 2 therapists? Because one therapist on the one side of the body and other on the other side of the body. It's requirement because we will go in the synchronized manner. In a parallel manner, we will be doing this procedure from legs to the feet, legs to the upper body. Gas stove induction to heat the powder or to the oil.
And again, this powder can be heated like indirectly?
No, I'll let you know in further slides. Medicines that we will require. The most common I have given the example, the medicated powder, how much quantity you require. For a healthy individual, you need minimum 250 to 300 grams for a one person. Okay? And next is the most frequently used for any kind of condition like obesity. So we are over trifluchurin. As the name indicates, it's a 3 phala. Okay? So 3 phala means ki amla ki, harit ki and vibhit ki. Like the picture also shows. Okay? Oil also for abhyang we will be doing in this procedure. I'll let you know where we will be doing abhyang and how. For this we will use most commonly sesame oil and olive oil. Most commonly. Pre-procedure, before doing any procedure, what we need to do all things. First of all, the fitness assessment. Before doing any of the panchkarma procedure, you need to analyze or assess that patient is fit for performing or getting the procedure or not. So for that, observe the for patient for fever and infections. If in case the patient is suffering from any kind of fever, any infection, we are not doing this procedure. Okay, any of the panchkarma procedure. Monitor vitals including blood pressure, pulse rate and respiration rate should be recorded. Before performing the procedure, you should record these vitals before. Patya aharya, that means void urges. You should ask the patient to defecate the bowel and empty your bladder before performing the procedure, as it will be easy for the patient also and for the performer to conduct the procedure easily. Nil parorally, prior to 2 hours before the procedure. Usually it should be done empty stomach, because during the digestive process the metabolism is ongoing, so we are doing it empty stomach. In case patient had food, then there should be a gap of 2 hours between the procedure and the food he had. Counseling, orient the patient regarding the procedure, duration and benefits. Well, I'll also be letting you know about the hands-on training time. I'll also orient about you the what will be the benefits of the procedure, what will be the procedure, what we will be doing and what will be the benefits. So definitely orient the patient before in hands on what you are going to do with the patient. Abhyang. Abhyang with the oil. Selection of oil depends upon the disease condition. Most commonly we use sesame oil. Now why here we are using Abhyang? As patient's skin is kind of sensitive, everyone is not sensitive, but some kind of patients are having sensitive skin. So to provide irritation, skin rashes, we are applying Abhyang. Yesterday Oxford taught you about the different maneuvers of each part of the body. So you are not going to do each maneuver that was taught yesterday, but a slight mild Abhyang will be given to each part of the body, which we are going to use for the Abhyang, for Udvartana.
Okay, the first Abhyangam, then after that.
Okay. Heat the herbal powder. We will not be using the powder indirectly, like taking and applying over the person's body. No, we need to heat it. We can directly heat it. As if oil, we are heating it indirectly, taking a pan and then boiling the water and then with a bowl, putting the oil and then indirectly heating. But for the herbal powder or medical powder, you can directly heat it, but you should heat it in a very mild flame. It shouldn't be heated in a very high flame. If you are heating in a high flame, it may get burned easily. So constantly stir it while heating it and heat it in a very mild way so that it doesn't get burned.
So before applying powder, this oiling is required?
Yeah, oiling is required.
Okay.
In some patients only.
No, in every patient you have to do this. For that safe side, you should go for Abhyang before doing the...
So then it becomes like more than 2 hours process, isn't it?
No, sir. You don't have to give a full maneuver or a full all the features like you were taught about. Do this stroke, do this. You just have to apply the oil to the part.
Okay.
Just application.
Okay.
Like if it will take hardly 1 or 2 minutes, and then you perform your procedure.
Okay, so here we are. Okay, so it's not like complete Abhyangam.
No, not
It's just
complete.
applying the oil and then you carry on with the powder.
Powder can be mixed with oil. Powder can be mixed with oil.
I'll let you know in the subsequent slides, sir. Again, procedure. To begin with, the patient is asked to undress to minimum clothes, and then patient is asked to lie down in supine position on the Abhyang table. First of all, during the procedure, definitely will ask the patient to undress himself herself to minimum. He can wear the undergarments, but the rest of the clothes should be taken off, and ask the patient to lie in a supine position. Yesterday also it was taught to you, supine position is that when we are facing towards the roof or the ceiling. Okay. So it is done in the positions like first one is supine position. Supine means facing towards the roof or towards the ceiling. Next is the left lateral position. Left lateral means turning towards the left side. Next is a prone. Prone means facing towards the floor. And the last one is right lateral position, facing towards the right side. Yes, in the picture also you can see the patient is lying in a supine position and 2 therapists, total 4 hands are there. 2 therapists are in a synchronized manner, in a parallel manner, are giving the pressure to the upward side, upward direction. Okay, so this is the position mostly. You can see them my hand. This is, and pressure should be given to the from the palm of our hands. Steps. But all we will do, first of all, as I told you, do full body massage with warm sesame oil or olive oil. We need a warm oil, not very much, but to tolerable to the patient. We no need to perform all the maneuvers taught to you yesterday, but we need to give a light jump to the massage to the area, so that the skin of the patient doesn't get rashes and irritation. Pour the herbal powder over the part. Rub herbal powder with maximum tolerable pressure and movements. If patient's skin is sensitive, then mix the oil with warm sesame oil or olive oil for making its paste. Then rub this paste on skin. How we will do, we have performed the massage with the oil. Okay. After that, we'll be pouring first of all the powder and then rubbing it in a tolerable pressure. Means it varies from patient to patient. If tolerable pressure for me would vary than yours. So it is varying. So you have to judge during the procedure, but the normal pressure which I will be telling you during the hands-on training, I will let you know how you have to do and how much pressure the patient can tolerate. If patient's skin is extra sensitive, if the patient is saying that he is having a sensitive skin, you yourself have to just, the oil which you have used for the full body massage, you can add to that paste, make it in a paste form, not in a very liquid form, and then apply that paste to the body and then rub it on the skin. Okay. In case patient asks for the extra sensitive skin after applying the Abhyanga, so then you can mix it with the oil, otherwise don't mix, otherwise do with the powder form only. We need to move our hands from the feet to thigh and hands to shoulder. How will be the hand movement? As I told you, it's unidirectional upwards towards the heart. So in our legs, it will be going from feet to thigh region, and in our arms, it will be from hand to the shoulders.
Okay.
This sequence will be followed. We are not returning, we are just going upwards.
Because there is a friction involved, right?
Because if you rub it, it will cause irritation and redness and rashes too. For hips, the movements should be from thigh to lower back. Obviously, if you see to your back region, for hip region, it will go from the thigh to the lower back region. Generally, deep stroking is applied in this procedure, but it shouldn't be so much jerky or tenderness that patient should get jerky. But in case we are giving a deep stroke, means the pressure is applied to the area. When the pressure is to be given in a small area, thumb may also be used. I told you mostly the palm of the hand we are using, but in case if the area is like it's a forearm, it's the calf region, we can give pressure from the thumb also. I'll show you on the next slide. You can see the pressure is given for the thumbs. Okay, so we can also give. Mostly it is done on the small parts of the body. A calf region can be done, forearms could be done with this, not the whole body. Mostly palm pressure should be given. It is started from, in which sequence we usually perform this? First of all the legs and then arms. After that chest, abdomen, back and then the gluteal region. First of all we will be covering the supine positions and then after we will be going to the back side, prone position. Here I have made a chart and table type that which part of the body, in the which position, which type of stroke to be given to the patient at which part of the body. First of all, we will be going with the legs and the arms. As you know, legs and arms will be exposed during supine position, lateral position and prone position. Supine position, both the anterior aspect of the thigh, legs and our arm will be exposed. During lateral, if the patient is in the left lateral position, our right side will be exposed. When the patient is in the right lateral position, our left side is exposed. Okay, and the prone position, the posterior aspect of the thigh, legs and arms is exposed. In this we will be going with a linear stroke. Like if this is my arm, if I am will be going in the upward direction. Okay. This, like you can see this. Linear stroke. Linear stroke means longitudinally, upwards. Next is the sole, supine and prone position. As you know, sole doesn't have any kind of hair follicles or any kind of hair in that area. So we will be rubbing at that to and fro, rubbing. Okay. Like this is a sole. It will be exposed both in the supine and prone position. Next is the hands. Hands will be mostly exposed during supine and prone position. A circular stroke. As the yesterday also doctors have taught you that there are the metacarpal joints which connect the wrist to the fingers. Okay. So on the joints we go with the circular strokes. So circular strokes will be given. Okay. And in the fingers we will be going linear. And in the interphalangeal joints which are having in between the fingers, we will be going with the circle.
So it's because of the hair only which is going one direction.
Yeah, mostly.
If somebody doesn't have hair in the body?
But we need to then also give towards the heart. The sequences like that. They are very rare, those who don't have hairs, mostly are having hairs. Shoulders. Shoulders in this also supine position, lateral and prone position. In supine position, both the shoulders will be exposed. In the left lateral, right side will be, and in the right lateral, left side, opposite side will be exposed. In this, as it's a joint, ball and socket, so it connects our arm to the neck region. So circular stroke will be given both in the clockwise direction and in the anti-clockwise direction. Next comes the chest and abdomen. Chest as the anterior aspect of the part of the body. It will be only exposed during supine position. So we will be giving both linear and clockwise stroke. Circular stroke, both in clockwise and anti-clockwise direction. Linear stroke will be, let's say your back, so you will be going linear. First in the chest and then in the abdomen. And then circle. Both in clockwise also and both in anti-clockwise. Yesterday in Abhyang we were taught that we will be going in the clockwise direction. But in case of Udvartana, we will be doing in the both the ways. Clockwise and anti-clockwise too. Okay, yeah. And the because in Abhyang we use oil. Oil has a tendency to, with the Sukshma Guna, it can go inside the minute channels. But powder don't have any kind of tendency to melt inside our body or anything. Okay, it will be in the skin position only, skin connective tissue, superficial area. So we can go above, clockwise and anti-clockwise. But not in the case of abhyam. Next is trunk. Trunk is above the waist region, waist below the neck region. Okay, so pine later in prone position. We will be going like chest and abdomen. When we are doing separate, we will be doing both linear and circular strokes. When we are doing it together, linear strokes. Back region, prone position, we will be doing in the linear strokes. I'll let you know in the picture also. This is how the picture is shaped. That we need to pour the powder. After applying the oil to the area, we will be pouring the herbal powder to perform the procedure. Duration of the procedure, each part of the body in their respective position is massaged for 3 to 5 minutes. Usually the duration of Udvartana is 30 to 45 minutes. Each maneuver I told you about, each part of the body, if you are taking minimum 3 to 5 minutes for each part of the body, it will definitely be taking 30 to 45 minutes for you to complete the whole procedure. The number of days of treatment varies from 7 to 14 days depending on the nature and intensity of the disease. As I told you, it's indicated in the obese patients. I can't say that the patient will get relief in the first day or the second or the third sitting only. If you are seeing till 7 days the patient is getting relief and he is saying that he is getting much relief after that, you can continue till 14 days according to the nature and intensity of the disease. That's your point. Post procedure, what all things we will be doing. After completion of the procedure, the patient is asked to rest for at least 15 minutes. We will be saying the patient to rest for at least 15 minutes. Wipe off all the powder which he has on the body by using a soft towel. Please use soft towel in that tone, not the rough one. Use a soft one only. Okay. Ask the patient to wear the clothes as we have undressed him to the minimum clothes. So ask him to wear the clothes. Patient is allowed to take bath with the lukewarm water after an interval of minimum 1 hour. After that, patient is asked to take bath with the lukewarm water. We have to use lukewarm water only. We will not be going with the cold water bath or any kind of very warm water. We need because that will provide a warmthness to the body of the patient. So go with the lukewarm water bath. In this also picture you can see the patient is lying down in a prone position and two therapists in a synchronized manner is giving the pressure towards the back side in upward direction. In upward direction also you can go with this hand or you can go this way. Both could be done. Okay. How does it work actually? When friction is created, when you rub in the upward direction, it will, Udvartana opens the circulatory channels. If you are rubbing something on your body surface, it will create a heat, it will provide some kind of heat and circulatory channels will be opened up. Circulation will increase to that area.
How come it's towards the heart? So it's towards the heart like this.
I'm just showing you at this area, okay? It's usually as like that. It facilitates the metabolic activity. How it will facilitate, because when you are using a heat powder, a heat medicated powder, it will provide warmthness and will increase the metabolism. The pressure helps the contents of the vessel move towards the heart if applied strongly and quick. When you are applying the pressure strongly and quickly in the upward direction, as our heart is also doing against the gravity, it is bringing back the deoxygenated blood from the limbs area. So if you are doing it upward direction, it will help in that process too. This increases in nutrition in all tissues. If you are providing circulatory channels are increased and it are open, so it will helpful in the nutrition increment in that particular area. Friction of herbs causes increase in local temperature, due to which dilatation of blood vessel occurs. As I told you, when a friction force is created, it will cause increase in the local temperature, which will cause dilatation and will increase the circulation. Circulation will enhance the nutritional value of that area. What are the benefits of Udvartana? First and foremost, I told you it is very beneficial in the obese person. So it will be reducing the excess of fat in the body. It liquefies the fat molecules from the body. It promotes the glow of skin. It will provide the complexion to the skin and luster to your skin. It will lead to sense of lightness in the body. Obese patients are, when obesity is relieved due to this process, it is reduced, it will provide a sense of lightness to your own body. It will eliminate the bad body odor. Some persons have some kind of bad body odor, so in that it will helpful in that also. relieves the muscular fatigue. As I told, the friction will create the circulation channels to be increased. So that circulation will help to enhance the muscular fatigueness to reduce. So muscle strength will be increased by performing this procedure. It reduces excessive sweating, as the obese patients, their excess of fat is reduced, so excess of sweating will also be reduced. Increases the stability of body, as it provides the muscular strength and reduces the fat molecules from the body. It will provide you a stability to the body. Rubbing stimulates both motor and sensory nerve endings to various parts of the body. All of the persons we are having, if I pinch your skin or I will touch you, you can examine and you can say because you have a sense of touch and because of nervous system we all are having. So it will stimulate them also. Next are the precautions. What are precautions you should do while performing this procedure? Before Udvartana, I also told about you earlier that bladder and bowel should be emptied before in handling. It would be easier for the patient itself and for the performer who is performing. Avoid dusting of herbal powder on face, nose and eyes to prevent irritation. In starting only, I'll let you know that we are performing this procedure before the neck. So why we are doing this? So our face is the most sensitive part of the skin and the whole body. So if we are rubbing a powder on our skin, on our face, so it can cause skin abrasions or redness or itching to that area. So we are avoiding to doing that above the neck region. In nose also, if it gets instilled inside a nostril or in our eyeball, it may cause irritation to all of us. Aseptic measures should be taken if patient is suffering from any contagious disease. In case if the patient is suffering from any kind of communicable disease, you should wear your mask, your gloves, in case that communicable disease may affect you also. So be on the safe side. Jerky movements should be avoided, as the procedure needs some kind of deep strokes. So it shouldn't be like that you give so much vigorous pressure to the patient that he is having a jerky movements or pain in that area. So why to do that? Tender areas should be avoided for Udvartana. Tender area means if you are pressing a part of a part of the body of the patient and he is saying that he is suffering some kind of pain in that area. Avoid doing that procedure to that particular specific part. If for example he is saying that I am feeling tenderness in my elbow joint, in my shoulder joint, try to avoid that. You shouldn't perform any kind of procedure at that particular part of the body. Complications. If you are not performing this procedure accurately, which all things you can land it up. Redness of skin. If you are not performing it in a unidirectional way, it may cause redness. See yourself, if you are rubbing with any kind of a rough thing in your body skin, it will cause redness to your body too. Dryness, again, dry skin conditions, it shouldn't be done this procedure. First degree abrasions can also be occurred in case you are not performing it properly. Irritations, hair root damage. Some patients are having excessive hairs on their body. So definitely ask them to shave them off. Not to be fully waxed it off, no, but to some extent of height, hair should be shaved it off. So you can perform it, the procedure. In case you are not performing and doing in a very thick hair person, then it may cause infection for the hair follicles and may land up into folliculitis and skin rashes. Thank you.
Why these Udvartana and all, it's being started from the back only, back in the neck?
Not back, from the front, supine.
Okay, so like just Abhyangam we start from the neck and the back first.
Because from the legs we are starting from towards the heart. So we need to give pressure from the legs towards the upward. It's a
Okay, here it goes
direction.
opposite. Okay, like you start from the
From
legs.
will go with the upward direction. For Udvartana will go from the
legs to up.
upward. Both in the supine and prone position.
Why can't we mix the oil with the powder?
You can mix, sir. Definitely you can mix.
No,
but
you told that in some cases.
in some case, if the patient is saying that he is sensitive, his skin is sensitive, then only.
Abhyangam is something which you do it like prone first.
That's your call. It's not only key, but there is a setup for this that you need to go for the supine, then after the left lateral, prone, and then right lateral. It's a position.
Okay, that's something we learned yesterday.
In Abhyang also, it was taught to you yesterday that straight legs, extended legs, when the patient is sitting, then supine position, and then after that left lateral, then right lateral, then prone position, and then again to the. Yesterday it was taught to you, 7 positions were taught to you. It is done in that situation, that posture, from starting to the end. So we'll be having the hands-on training session now only after this